Hi, and welcome to Claudia's Lifestyle. I'm so glad that you could tune in with me. We're doing this series on American healthcare, healer or killer. Which one is it? Is the system helping us? We're going to discuss it. Today, we're going to be talking about pharmaceuticals. We're going to be talking about those prescriptions, the medicine. We're going to be talking about what they give you, what they prescribe when you go into their offices. We are going to talk about chemicals, drugs, and the pushers that give them to you. They used to say, don't deal with pushers. Don't pass by the pusher on the street. Just say no. I'm telling you, just say no to the doctor. Just say no. You had a right. You're in charge of your own health. And they use scare tactics. That's why the system is so abundantly financially wealthy. Because it's been instilled to believe that the doctor knows best. It's a lie and the truth is not in it. Things have changed. Medicine has changed. Doctors have changed. The healthcare system has changed. And you have changed. Okay? Don't get caught up in the healthcare matrix. Come out, everybody come out of the healthcare matrix. Don't let them kill you. And you can do it. We have been putting our faith in the healthcare workers, in the doctors, in the hospitals, the medicines, all in the wrong places. We are in a capitalist society. And it's an experiment, and it's gone awry. The capitalism has overtaken our healthcare, and they don't want us to buy medicines from out of the country. They don't even offer herbs. Other countries do. They incorporate them in their healthcare system. But not America. Hit the little subscribe button because I'm keeping it really real. Keeping it really real. Kirr. I want you to know. Because I was upset when I realized that they were playing with me. I was letting them do surgery. I had thyroid surgery. Had I known that the medicines would not replace what I was missing, what I would be missing when I allowed them to take the thyroid out, I never would have allowed it. Our bodies would have come with scissors if things were meant to be cut out. I think God, who is all intelligent, would say, hey, I'm going to give them scissors. No, he made our body where it regenerates. The organs regenerate if treated properly. Yeah, they don't want to tell you that. So don't let them cut you up, fill you with a bunch of drugs. You're paying them to kill you. Because it's either helping or killing. That's your decision. You can stay in the matrix and let them keep you on a slow kill, thinking your doctor loves you, he's doing great wonders for you, but you still have the same disease that you had 5 or 10 years ago. I'm keeping it really, really real. Kirr. They don't care about you. They don't care about you. You have to love you. Your doctor gets paid. Oh, he's paid nicely. but he's slow rolling you to death. Okay? So you need to wake up. Take care of yourself. And know that they are not about you. All right, I went on my little tangent. Okay. So the plants, the pharmaceuticals, they're not here to heal you. They're here to kill you. On the slow roll. They're going to slowly do it to you over some time. Okay, while you keep paying. You keep paying them to kill you. I'm not going to do it. Okay? The drugs used to be made from plants and things in the earth. Okay? Doctors used to work on curing you, so you didn't have to come back to them. That's when there were real medical schools. Doctors were really learning. Okay? But there's been a difference in the approach now. They only deal with you once you're sick. They're not taught how to keep you healthy. They're taught to deal with the disease once you're getting it. So our healthcare system is on a disease model, not a preventive model. It's on addressing the disease, the symptoms of the disease. That's what our healthcare is doing. Just addressing symptoms. When you say symptoms, we got something else. If there's some side effects for that, then we got that. And before you know it, you're on 8 or 10 different drugs. Treating the side effect of the last drug. And all of those chemicals, nobody has tested the effects of you being on 8 or 10 different chemicals at one time. Don't let them fool you. They may have tested one chemical compared to another, because that's what they do in medical school now. They're not actually testing what this drug gonna do to you, so to speak. And the FDA relies on whatever they test. Okay, so these pharmaceutical companies do their own testing, and then they turn their tests into the FDA. And the FDA approves based upon what the pharmaceutical company gave them in the testing. There's no testing being done by the FDA. FDA does not test. So these pharmaceutical companies are left to check behind themselves. It's up to them to make sure that it works. And as you can see, over time, they turn in great and fantastic results to the FDA. And then years later, there's a lawyer. If you've been treated by this drug, come to us and we'll get some money for you. We'll address that claim. But wait, when you submitted it to the FDA, they said nobody died because of this. They're not telling the truth to the FDA, and the FDA is not checking to see. Later on, we find out the real deal. So when they come out with all these fancy medicines, take it with a little caution. Okay? Or as we say back in the day, with a grain of salt. Okay? Pharmaceutical companies went in order for a doctor to get his MD, he had to go to medical school. He had to learn how to interact with the chemicals. He could no longer just treat you with plants, herbs. He had to use the chemicals supplied and learn how to navigate the chemicals that the petrochemical company provides and produces, and the pharmaceutical mix them and give them to you. Okay, so in order to become a doctor, it changed. You had to be able to deal with chemicals to get an MD behind your name to be a legitimate doctor. That shouldn't have changed. We should still have the capacity to use herbs if we choose to heal. We shouldn't have to purchase these drugs to live, because you're not going to live. These vaccines, well, we'll go into some more about the pharmaceuticals, and it may be a little repetitive because I want to make sure that everyone gets it. Not everyone is going to participate in the whole series. But I want us to come out of the healthcare matrix and research and study our own health. Be more sensitive to your body yourself. A doctor in a 15-minute visit does not know your body better than you. You've lived in that body for years. And so you know your body better than the doctor. But anyway, these drugs that kill you are costly. You need an insurance company to help you pay for them. You got to pay the co-payment, and then your insurance company has to make a payment. Why? It's not going to get you well. Okay? It will not increase your lifespan at all. And if it causes a side effect, which it normally does, have you seen the commercials lately with all the side effects? Have you paid the health care costs for insurance to pay for these medicines? Really? I am keeping it really real. Take care of your own self. Make your own health care decisions. You can say no to the doctor. You know, a lot of our elderly people think doctors know best, and even young people. You can say no to the doctor. They're going to use scare tactics. See, that's what sells all of this medicine, the scare tactics. You're going to die if you don't get it. If you don't get this vaccine, you're going to die. We got to test your blood. Why are you off this high cholesterol medicine? That's it. They're scaring you. This year, you can see in this great pandemic, all the scare tactics are really coming out. This is the year of clarity. 2020 is clarity. But anyway, let's talk about the side effects for the few minutes that I have left. If you go on television, you will see so many commercials. And there was never as many commercials to sell pharmaceutical medicine as there are today. You're watching the news, there it is. There is medicines for things you can't sleep, dry eyes. There's medicine for things for problems that we can eradicate ourselves, or problems that we can heal ourselves. If you were exercising daily, you could sleep at night. Okay? So some of the things in our healthcare system that they tell us is okay is not okay. It only leads to disease. Some of the foods that the government tells you is going to keep you healthy is not. Lies, lies, lies. I'm keeping it real. Keeping it really real. It's lies. Your doctor is a pusher. The pills are fake. They're trying to slow roll you into death. Take care of yourself. So we'll be going into this a little bit more in depth in future episodes. Maybe a little repetitive, but I'm so glad you could tune in. Click the subscribe button. Come back and hear a little bit more about this healthcare matrix, American healthcare, the healer or killer. You decide. My name is Claudia. I love you so much. Health is wealth. Have a great day.